There are many of us in this room that have a family member at home that's fighting the cancer, and many of us are also here because we lost a family member and we're scared. The most important to us is to be in a setting where we can ask questions and not feel silly asking the questions.
I just have a question about having my kids tested, because I know I have it. My mom had breast cancer. Is there anything relating to there? Or is
you know, if it's only one case of pancreatic cancer in the family, then your kids shouldn't be tested for it. They should be focused on the preventive measures at this point in time.
Until today, I've never even met another person with pancreatic cancer. This is the first time.
For the survivors and for the children of the survivors and the relatives and so on, I got the impression that it's probably good to increase your diet with vitamin D. And I think I know how to do that, but for the turmeric, that's another thing to add.
So before you start taking a bunch of pills, I'm going to say, are you a smoker? If you're a smoker, stop. Let's do that first. And any of these suggestions that you give, the trick is always in making it practical and executable. Most people don't exercise sufficiently. The diet for I meet very few Americans who have an adequate diet. So I'm going to fix all those things first, because if those aren't right, you can't wash away all that by taking a little pill. And if you're exercising and your diet's good, then you've also reduced your risk of heart attack, stroke, colon cancer, breast cancer. Stop me anytime. So what people then do is go, just like they do with conventional physician, oh good, I don't have to eat well, I can just take a pill. No, no, and way no here.
A lot of our patients have difficulty eating, so we talk about, and some of you know that I say this, that 3 cans of Ensure a day. I'm not committed to Ensure. Ensure doesn't pay me to say Ensure.
Right.
Do you, in your work, do you think that there's a better supplement, liquid supplement out there?
I usually ask people to make whey protein shakes, because the quality of the protein then is better. You don't have a lot of sugar. You can put fresh fruit or something in that instead, or canned fruit or frozen if you need to. So I use those foods as rescue foods if I have to, but anytime I can make something that more approximates real food, I like to. And whey protein is almost a complete protein. It tends to be anti-inflammatory, and it's designed to support lean tissue. And then you have a lot more control over how much protein you get in. Again, because Ensure is heavy on carbohydrates and fats and lower on proteins than I would like.
There seems to be a sort of a difficult balance between managing pain and problems that causes, that pain management causes. So you may eliminate one problem and it brings on another. I mean, it's probably different for every person, but do you have a general thought on that?
Generally what happens when you do pain management is your GI tract is affected and you get constipated. And that's pretty uncomfortable. You want to keep yourself from getting constipated, so how do you do that? You can do that with nutrition. Prunes, too many, 3 not enough. I mean, you kind of have to find that balance. Bran, putting bran on your cereal. I think Miralax is a great over-the-counter drug.
Sometimes people throw in Senecot or some of these other stool softener type of things, but really Miralax is a great, or Glycolax. I don't have any loyalty to any one type of those polyethylene glycol type of preparations, but that's what I would push for. The other thing is, with the pain, it depends on where the characteristics of the pain are. If they're across the upper abdomen, sometimes in the area of the celiac nerve, then there are some things that can be done by a GI doctor or a pain clinic person. We do a lot of celiac neurolysis blocks, so that we'll inject it. And it's not practical to think the pain will go completely away, but what we try to do is prevent all these peaks and troughs and try to make it a little bit so it's a little steadier in terms of the pain.
Again, this might be a time where complementary and alternative therapies will not take away 100% of the pain, but anything that can reduce the opiate burden then helps reduce the consequence of side effects. So we might include an acupuncture, certain kinds of massage, certain kinds of relaxation or meditative practices, etc. And if you start practicing earlier, then they carry you a nice long way. I think what you're hearing is saying it's never usually one thing. It's usually a little this, a little that, sometimes a lot of something else to get the right effect for the right person.
We've heard for years now about 2 first-degree relatives and the increased chance. My question is this: Is that because they haven't studied two parents, or because two parents don't present the same way as two first-degree relatives on the same side?
Talking about a gene pool here, and so they're probably multifactorially at an increased risk because of having the two family members. We don't know if it was environmental risk factors, because as being married, they were exposed to a lot of the same environmental stuff, and superimpose if they were from maybe had a similar genetic background. It gets to be pretty complicated, and we still don't have a good handle on that subset.
Hi, I'm asking this on behalf of my mother, who's a 1-year survivor of pancreatic cancer. She wants to know if you know of any third-stage trials that show any kind of promise at this point.
You know, every trial in some ways is successful. The problem is that we're trying to say that every cancer should be treated the same by giving them agent A or B. And that may not be the answer. The answer may be that with these characteristics, this tumor should be treated with agent A, this tumor should be treated with agent B, this tumor should be treated with agent C. So we could select out that 10 out of 100 patients that respond to agent A. Let's just treat those 10 patients and give those 90 patients something else. And so that's what we're trying to work on and get more sophisticated at. So we may actually have a lot of good treatments out there. It's just selecting the right patient to get the right treatment. I think, so we're starting to rethink our treatment strategies.